And so I just have a question. Do you use these techniques if the person doesn't present any neurological systems, or just if they are already with symptoms, or you just do like preventively and take a look in each patient, or is there a specific type of patient that would benefit from these techniques?
Yeah, well, a lot of what I see, that people equate what I do in being a physical therapist to pain management. So a lot of times people will come in with some kind of pain or ache, and often, I'm trying to determine what's the most appropriate treatment. So I'm not like always, even if it's neurological. I often, my mind starts to think I should probably try to, either access, I use 𝗏𝗚𝗂𝐬𝐿 therapy on the nervous system quite regularly, nerve mobilization directly on the nerves and the dura, with 𝗏𝗚𝗂𝐬𝐿 and nerve also working on the dural membrane throughout the spine. But I try not to get too influenced before I put my hands on. They might come in and, I'm starting to they're kind of telling me their history, and they maybe they're describing I've got pain in my eyebrow in this area, and it seems to go up and around and through here. And then I have pain through, the distribution to, through a radial nerve distribution to their first and second, thumb and index fingers, numb and tingling, or pain shoots down to their elbow. And so I start to think, okay, maybe there's there's a trigeminal nerve that kind of leads through the system to really kind of connects through the cervical plexus and down into the brachial plexus, which then turns into the radial nerve. So it's really just the same nerve, but in my mind, if a patient's telling me, oh, I got this bad headache and it's right here, I push on this spot, I start to think in my clinical mind, maybe I should check their cranial nerve or the trigeminal nerve, and then I might have to do some brachial plexus work, but I don't really determine that until I start to feel. So if they have neurological symptoms, I'm probably going to be really open to doing nerve mobilization and checking on that system. But I want to make sure that there's nothing else pulling from below. For instance, I had somebody who recently, I thought that they had a trigeminal nerve problem. They were coming to headaches. And it turned out that I did a liver release on them, so visceral manipulation, and which could have had that phrenic nerve connection too. So I don't discount that it could have. I've been doing I may have been accessing the nerve and doing nerve mobilization to free up around the liver and free up the phrenic nerve, but it was really quite a restricted liver. When I released that, the person actually had like a shaking. They kind of started twitching in their face, and it was shook in their body a bit. And they came back next time saying 95% of their headache went away.
Oh,
and I didn't really do a whole lot of work on their trigeminal nerve or their brachial plexus. So, sometimes if they're having neurological symptoms, as a practitioner, you have to really almost like a tabula rasa. You have to have a blank slate. I'm not going to assume anything, and I'm going to have a clear and neutral mind, which I think, one of the things I think, we've discussed and you asked me about is what would you, advise, a clinician to do, and as much as you can be influenced by what a person says, and they might even say the pain's right here, buddy, can you work on my shoulder? You really have to stay neutral to what you feel and find in a person's body, and then really pull out the tool when you need it. So yes, nerve mobilization is what I think is actually one of the more effective therapies that I've ever learned and have used, and I find to be swift and quite proficient and very long lasting actually too. But I always stay neutral when I'm treating, and try not to outsmart the body and think that I'm smarter than it. And I respect it as being my greatest teacher, and really what I should always be listening to and following. So that's the greatest advice I could give to any clinician, any student of the work, in any physical therapy aspiring to learn manual work is that if you follow the body, it will never lie, and you always use your palpation technique, and you can use all your kind of listening skills to follow what the body what the body is directing you towards, which is maybe a tensional pull or some kind of area of restriction that seems greater than all the other ones in the body. So if you could determine that and you work on that, you treat the body like a trail guide. So let's say there's a restriction here, and you determine this is the most restricted area. Okay, well, what is it? You determine the structure. You treat that structure. But then you can't assume you know what you're going to do next. Like maybe the next spot's over here and you didn't know it. So you always have to stay in that neutral state of mind to stay sensitive to the fact of there might, at some point, here's the primary restriction, and here's maybe the next spot you work on that you have no idea you're going to go there, but you're staying attuned to the fact that there's going to be something else to work on next, and you release this primary restriction just enough where then this one rises to the surface. So then you'll treat that next one and you determine what that structure is. You pull out the therapy that the specific, according to the specific three-dimensional anatomical structure, and you pull out that therapy and you try to resolve that spot until it resolves. And maybe you're getting like just enough for that to resolve to move on, which so some people say, well, once you treat it, doesn't it just go away? And sometimes I'll say, sometimes you need to revisit the spot multiple times to get it to resolve. So what I think really what a practitioner, the greatest service that you could give somebody and the most efficient way to treat somebody is to resolve that primary restriction as much as humanly possible in that given moment until something rises to the surface that's more primary. And then you'll go around like a trail guide and try to treat different areas of the body in a specific order. And that's really, I think the best way to treat somebody is to try to really stay open to listening to the body.